Let's start our discussion of the spinal cord and spinal nerves. The central nervous system consists of the spinal cord and the brain. That should be review. Central nervous system, brain, spinal cord, peripheral nervous system includes the nerves that arise from the brain and the nerves that arise from the spinal cord. So the central nervous system integrates and processes information and decides what we're going to do about it. So these organs can function together or can function independently. When we look at the spinal cord, a good place to look at it is the video, The Unfixed Spinal Cord. So that's posted on your Canvas. I recommend you watch that because that is an opportunity that we don't have in the book or even in hands-on lab. So that is an unfixed spinal cord, meaning recently harvested and not treated with formaldehyde. If we were able to have our face-to-face lab this semester, we would be looking at fixed brains of sheep and cow eyes. We're not going to have that opportunity, but you can watch the unfixed brain and the unfixed spinal cord on YouTube. All right, so in the spinal cord, we have the cervical enlargement, right? So there's a place in the neck region where the spinal cord is just slightly wider. Same in the lumbosacral enlargement. The conus medullaris is a cone at the caudal end of the spinal cord, the inferior end of the spinal cord, that gives rise to the filium terminale. And then we have the cauda equina, which is just it's cauda equina for horsetail, and it's nerves that are coming out that are no longer considered part of the spinal cord. We have the posterior median sulcus and the anterior median fissure, and we'll see those as we look at some illustrations. All right, so these regions should be pretty easy to remember if you remember your vertebrae. So cervical spinal nerves are arising from the cervical region. So when we say spinal nerves, we mean a nerve that is arising from the spinal cord. And we'll talk a little bit more about that in a minute. Thoracic region, right? Same as the thoracic vertebrae, right? And Newton's putting in his 2 cents. Then we have the lumbar region. There you see that lumbosacral enlargement. There's that conus medullaris, right? And so this is leading gradually to the inferior tip of the spinal cord and the cauda equina. So at this point it's just nerves, right? All right. So let's think about a spinal nerve. So we have 31 spinal segments. Each segment has a dorsal root ganglion, a ventral root, and then those two fuse to become a spinal nerve, and we'll look at that momentarily. So those are mixed nerves. So remember we talked about sensory coming into the brain, motor coming out. So at this point, a spinal nerve has both outgoing and incoming messages. So our way of saying that is afferent and efferent fibers. All right, here's our look. Dorsal root ganglion. So that's our quick clue that that's going to be a dorsal root. That's going to be sensory. Here's our ventral root, right? And at this point, it becomes a nerve. So we've got dorsal root, ventral root, then a nerve. Posterior median sulcus right there, anterior median fissure there. So notice the fissure is deeper, and notice the central canal. Notice the gray matter and the shape it makes there. We can notice that this shape of the gray matter inside the spinal cord differs as we move along the spine. Okay, and there we see our sacral, lumbar, thoracic, and cervical. These thoracic nerves are pretty much just straight, and they go between the ribs, so we call them intercostal. And then the cervical, we have the plexus, right? We have that makes a network of nerves that come and that merge and separate. All right. Let's look at the meninges. We're going to come back and look at the nerves themselves a little more closely. Let's look at these layers, these protective layers around the brain and the spinal cord, and those are called the meninges. They're providing protection, physical stability, and shock absorption, and they are continuous with the cranial meninges. So that covering is going over the brain and over the spinal cord. The outer layer is the dura mater. You can think of durable, right? It's tough, it's leathery. When you're looking at that unfixed brain video, that kind of leathery stuff hanging down from the brain as you hold it upside down, that's the dura mater. It is tough, fibrous, outermost layer. Arachnoid layer is the middle layer. Arachnoid mater is the middle layer. Pia mater is the innermost layer, and it adheres to the brain. All right, it's just membrane that's tightly adhering to the tissue of the brain. Right, so they're saying adjacent, so it's pretty closely on there. Okay, you do need to know the order of those meninges, and here they are again. Pia mater, closest to the white matter. Arachnoid mater is the next layer, and then dura mater right here. All right. So here we have that H-shaped gray matter. We have the white matter around it in the spinal cord. We have that dorsal root ganglion and the little rootlets coming out. Here we've got the ventral rootlets, the ventral root, and then at this point, after the ventral root and the dorsal root have merged, now we call it a nerve. So this part out here is called a nerve, and it immediately begins branching again. All right, there's our vertebrae, right? Get that much and you are in good shape. There will be pictures similar to this on the exams. So that dura mater, remember dura for durable, is that tough fibrous outermost layer of the meninges. That epidural space is the space between the dura mater and the lining of the vertebral bones. So epidural between the dura mater and the vertebral bones. Coccygeal ligament, as the dura mater blends with the filum terminale, thus forming the ligament. So remember, a lot of these structures, we have different names for them, but one is continuous to the next. All right, let's look at that. Here's our bone, spinal cord. This is the rest of the vertebrae. Here's our anterior side, posterior side. Denticulate ligament, holding things together right there, okay? There's our dorsal root ganglion, all right? Adipose tissue in the epidural space. Adipose tissue in the epidural space. So this is fat that is providing some cushioning, protection. All right, we've got some more layers in here. Subarachnoid space is between the pia mater and the arachnoid mater. Okay, and there's some fluid in there.